This exercise is called 90-90 breathing. So you're going to start off on your back, feet on the wall, and that 90 degrees of hip flexion, 90 degrees of knee flexion. We're going to just start off working on that nice 360 breathing. So what that means is the rib cage moving forward and backwards evenly, side to side, a little bit up and down. What I don't want to see is it just going up into your chest and shoulders, neck overactivating. So we want a nice, good movement from the rib cage evenly in through the diaphragm, gently on the pelvic floor. So first we're going to start off just with breathing, and then I'll talk about a little things that you can add to it. So trying to work on inhaling and then exhaling all the way out. So as we inhale, everything moves and expands evenly. See if you can inhale for about 4 seconds, inhaling through your nose. And then as you exhale, make sure everything exhales all the way out. Rib cage should come down and in, belly should evenly flat. What I don't want to see is inhaling and the back comes off. So you should feel that nice expansion through the back. As you exhale, I shouldn't see any abdominal pooching. So everything should be nice and even, no pain, no extra pressure. So again, inhaling and exhaling. If you feel like you have a hard time getting the shoulders to not overwork, you can raise that dominant arm up in the air. That's going to take some pressure off of that, make it a little harder for that upper trap to overwork. You can also add a small ball or a towel roll or a pillow in between the legs. Just get a nice little squeeze that gets the adductors on board, and that's going to help some of the pelvic floor fire better. As you're squeezing, make sure we're not overworking the hip flexors, so that should be nice and soft and squishy. Make sure you're not overworking the deep hip rotators, the same thing, that should be nice and soft. You can also widen your legs a little bit if you feel like you have some posterior pelvic floor tightness. And then you can even just gently engage your hamstrings by trying to curl into the wall. And that's going to take some of the paraspinals, those muscles in your back, out if you feel like the back's working a little too hard and really tight. So if we try to bring that right arm up, a little light squeeze in the ball, feet a little wider, gentle pressure into the wall, make sure the hip flexors are relaxed. Inhale, nice 360 breath. Hold at the top, and then exhale. Everything out. So see if you can try to do 4-second inhale, hold at the top for 2 to 3 seconds, 6 to 8 seconds, exhale, hold for 2 to 3 seconds. Just do a couple of breaths, maybe 3 to 5 breaths, and then stop, take a little break.